I didn't start off in the field of psychology. I actually started in education. And it wasn't anything about not wanting to follow in my father's footsteps. I had always just wanted to be a teacher ever since I was about 5 years old. As an undergrad, I studied education, and then I got a master's degree in educational psychology, and then a couple of years after that started a doctoral program, mostly in education at first, but then I got more and more interested in psychology and became a cognitive therapist. And now I've really kind of come full circle, because most of what I do now is teaching, either through writing books, giving workshops and presentations throughout the world, teaching the psychiatric residents at Penn, writing and then teaching our online courses, and a number of other activities that all have to do with education. And then a couple of years later, he was given a big award in Philadelphia. And the person who introduced him recited all of his many accomplishments, very few of which I had known about. So it's interesting that I didn't know that my father was a big deal until I was already in the field of education. And of course, once I really started to study cognitive therapy, then I began to see how important he was to the field. I think my major contribution has been in educating others about CBT. So I wrote the basic textbook in the field, Cognitive Behavior Therapy Basics and Beyond, which has been translated into over 20 languages, and its sequel, Cognitive Therapy for Challenging Problems. I spend a fair amount of time on the road each year, giving workshops and other presentations, both nationally and internationally. In 1994, I co-founded the Beck Institute with my dad, and although we were originally primarily clinical, the dream had always been to make Beck Institute into a training organization. And I think we've really fulfilled that mission, and my contributions have been in developing our workshop programs that we give on-site and also off-site, in developing the training for organizations that we do. Large organizations come to us to help them either initiate or improve their CBT programs, and we do training and supervision of therapists. We also have a supervision and a consultation program. And finally, in the last couple of years, I've been spending most of my time and efforts on developing online courses. So I think my major contribution has been in teaching others and disseminating CBT worldwide. So how can we disseminate CBT more effectively throughout the world? Well, I think there are a number of ways. One is through online courses, such as the ones that we've recently developed, that can really reach all of the different parts of the world. A second is, I think when we're teaching CBT, it's going to be very important for us not to teach it to people in a manualized way. You know, treatment manuals were written so that there would be fidelity and consistency in research trials, and the principles in the various manuals are very important to learn. But really an overriding concern, I think, is teaching clinicians how to conceptualize the individual patient and then plan treatment based on this conceptualization, informed by the principles in treatment manuals. So I think we can also use social media, and as technology improves, I think we'll be able to do more and more in educating therapists throughout the world. What I'd like to see in graduate training programs in all mental health fields is a reliance on evidence-based treatment. There are still so many programs that teach psychotherapeutic modalities that actually have very little research base. And each year, the evidence base for psychotherapies like CBT is just getting stronger and stronger. I'd like to see that it's taught, and that it's taught really well in graduate programs, and that people who are supervising the trainees are certified as competent supervisors in CBT in order to do that. One of the big problems in some programs, it happens perhaps in psychiatry more than psychology, I'm not sure, is that students do some book learning about CBT, but then they have supervisors who really are trained in a whole different modality, and they end up getting very little, if any, supervised practice in CBT. So that's something I think that really needs to be changed. I think that cognitive therapy has evolved greatly in the last 50 years and will continue to evolve in the future. One of the things that I've seen happening in the last few years, which I find very exciting and I think will continue, is adapting techniques from other psychotherapeutic modalities within the context of the cognitive model. So CBT now, when appropriate, may incorporate techniques from compassion-based psychotherapy, from acceptance and commitment therapy, from dialectical behavior therapy, from psychodynamic psychotherapy, from supportive psychotherapy, from interpersonal therapy, from motivational interviewing, and I could go on and on and on. But I think having a variety of techniques from which to choose makes therapy much richer and much more effective. Another way that I think CBT will continue to improve in the future is by improving the treatment for clients who now do not have a full recovery from their disorder. So there are a certain number of clients for whom CBT doesn't help or who have only a partial response. And I think if we put a spotlight on that population, that we'll be able to figure out how we need to adapt CBT to be more effective.